I think listening to all of my colleagues today, listening to staff earlier, the complexity of the problem that we're facing is just laid bare. We went through a pandemic, isolation, trauma occurred during that pandemic. People are not well in the city of Toronto, and that happens on transit and in the street and in every sphere of life. And I think compounding that is the economic conditions that people are experiencing with low wages. You know, you need to have a $100,000 income to afford a one-bedroom right now in the city of Toronto. These are not small problems with people every day facing eviction and the rate of homelessness that we know exists in our city, just indicators of the kind of inequality that this city has to contend with, the most unequal city in Canada. I think that when we think about policymaking, it's always, for me, important to think about the people most impacted. So we've been hearing throughout the budget process and many months from transit riders and transit workers. And yes, they were united in the notion that we need more service, that cutting bus frequency and cutting how often the train is going to show up isn't going to make anyone safer. In fact, it's going to expose more people to harm. And now we can add the voice of the mother of Gabriel Magalhães, who, I don't know how she did it, had the fortitude 2 days after losing her son to speak to us and send a very clear message. She implored policymakers and decision makers to do the things that prevent a crisis. She also wanted to see social supports, shelter, housing, caring. And that is also what we heard from transit riders and transit workers, who with one voice told us that we need social supports, mental health supports, housing, crisis response. And that's also what we've heard from library workers. So this is a chorus, and it's absolutely essential that we pay attention. I also want to talk about what it means to be safe, because thousands of people don't have a roof over their head every night, and that's not safe. The numbers of the kind of violence that's grown more significantly across the board since the pandemic, and that never seems to lessen, is violence against women. And on transit, disproportionately, the victims of violence, whether they be a woman wearing a hijab or a woman standing, waiting for a subway train, have been women victims of violence on transit. I think that it's also important to remember that hate assaults are also really crucial, and I thank Councillor Myers for that motion. In terms of the federal and provincial government, I absolutely agree. We have to put it back on their doorstep. They have to take responsibility. We can't take this all on ourselves, and I will support Councillor Cole and the Deputy Mayor's motion with this regard, because we need to be a bit more rebellious here. Every single GTA, not just Toronto, but every single Greater Toronto Area Member of Parliament is in the governing caucus right now. They're sitting in Ottawa and they control the budget. Hold them to account. However, in relation to the Deputy Mayor's motion around bail reform, I just want us to remember that 2/3 of people sitting in jail right now have not been convicted of anything. And the time that they spend waiting to get remand, to be released, turns them into much more violent criminals if they are in fact a criminal. And if they weren't, because they're not guilty, they will not be helped by this experience. And we have to be careful about contributing to what we know is a huge driver of violence in our society, which is that system. You know, the one person I think who really spoke to what evidence works, what we know would work is Councillor Perks. When he questioned whether we need $15 million of discretionary spending by the TTC to hire security guards, when we know that enforcement doesn't work, and obviously I won't be supporting Councillor Holliday's motion, he won't be surprised, but we listened to the Ombudsman. I think that Councillor Cheng and Councillor Morley have it right. We need people who know what they're doing. We need an interdisciplinary approach, an all-hands-on-deck approach. But please, I implore you that what comes out of this is a crisis response, a care response first, a major commitment to making the investments that we know are going to hold people up and stop the crisis before it happens. Let's listen to Andrea Magalhães, who I think has the moral fortitude, and we should respect that direction.
5 seconds.
Thank you.